We're all proud to be Canadian, but I'm not proud of my healthcare anymore. There's something fundamentally wrong.
In a developed country like Canada, should you have to plead for healthcare on the radio, send letters to politicians, and wait years just to receive the healthcare that you need? Obviously, the answer is no, but that's what Stefanos Michelis went through in order to receive care for his newborn son, George.
My name is Stefanos Michelis. I reside in Toronto, Ontario. George was born August 1st, 2019. When he was born and he was assessed, they realized there was an issue with his urethra. He had a condition called hypospadia. So what that means is George's urethra, where he urinates from, was in the middle of his shaft, not on the tip of his penis.
Without treatment, George could develop psychological and physical problems down the line. While surgery is generally recommended before a boy is 2 years old, the Michelis family had to wait 3 years for surgery. The pandemic hit a few months after George's birth.
Everything, was on hold. My wife's a school teacher, we're tolerant. We understood surgeries and healthcare had basically, had to be on hold. So we lived with the condition and we just waited. Then the pandemic was coming towards the end and I was getting concerned. We'd ask our doctor, you're gonna have to reach out to sick kids. We would reach out to sick kids via phone call, can't get through to anybody. It was honestly like we were in the abyss. We'd send an email, we'd get a generic email back saying, all surgeries are on hold, only emergency surgeries are going through. And our son's condition wasn't a priority at that moment, which was fine. But then the pandemic ended and we still had no answers.
It's one thing for the healthcare system to face a large backlog, but it's another thing for it to ignore patients and to seemingly have no idea what's going on. That's what the Michelis family had to deal with.
My son basically waited 3 years for his surgery. Our first appointment at Sick Kids was November 2019. My son's surgery was January 2023. So over 3 years.
George is not alone. SecondStreet.org research shows that 1 in 10 Canadians are waiting for surgery, a diagnostic scan, or to see a specialist. Why do patients in Canada have to wait so long for surgeries like George's, or even more common treatments such as knee and hip operations? Part of the answer is because of how government funds healthcare. According to the government's Canadian Institute for Health Information, Canada spends one of the highest amounts on healthcare in the world. The problem is not a lack of money in the system. The problem is too many dollars are getting spent on administration and inefficiencies. The CBC noted that George's condition was fairly common. Yet there was just one urologic surgeon at Sick Kids Hospital doing this kind of surgery.
So me doing some research with some friends and family from Sick Kids, we found out that the urology department had 2 surgeons doing the surgery. Each surgeon could do 60 to 70 surgeries a year. Well, one of the surgeons left before the pandemic. So that left this world-renowned Sick Kids Hospital with 1 surgeon.
60 to 70 surgeries per year is about 1 per week. The surgeon would have all kinds of time on his hands. This is a big problem in Canada. Surgeons are often left to twiddle their thumbs because not enough money is spent on surgery. It's getting used up for administration costs and other inefficiencies. Instead of governments giving hospitals big checks each year and hoping for the best, governments could do what many European countries do and fund hospitals based on their output. Simply put, every time a hospital completes another surgery, they would get more money. This would incentivize hospitals to focus on output and spend less on administration. The Fraser Institute, Montreal Economic Institute, and others have recommended this idea for years. It's called activity-based funding.
Activity-based funding flips the system on its head. Instead of having every patient drain the budget, it actually ties the money to the patient's arrival at the hospital. So it's money following the patient. All of a sudden now, as patients are bringing revenues to the hospital and the hospital's not getting revenues for not seeing people, it is the incentive to see more patients and see them more efficiently is created and significantly enhanced.
Fortunately for George, his parents were eventually able to get him the care he needed. They did media interviews, they wrote emails to politicians, and put pressure on the system to help their son. But that's not how the system should operate.
It was like a lottery, really. You're just waiting for your number to get called. And I hope nobody has to ever go through that. The waiting game is not fun, especially when you have to deal with your child, right?
To learn more about healthcare reform, please visit us at secondstreet.org. And don't forget to hit the subscribe button.